Welcome, and thank you for joining our virtual webinar, Wound Care for Perianal Fistulizing Crohn's Disease. Wound care management is a key element in the overall care and healing of perianal fistulizing Crohn's disease. This webinar will take you through the importance of proper wound care at home and discuss the importance of medical care, follow-up maintenance, nutrition, and emotional support to ensure you are living your best quality of life. We have put together a team of experts to discuss these topics today. Welcome to our program. My name is Sinyu Wong. I'm an assistant professor in the Henry D. Janowitz Division of Gastroenterology at the Icahn School of Medicine at Mount Sinai. As a physician scientist whose clinical and research focus is on perianal fistulizing Crohn's disease, I conduct clinical, translational, and basic science research aimed at better understanding the impact of perianal fistulizing Crohn's disease on patients' lives, on clinical outcomes of perianal fistulizing Crohn's disease, and the interaction between host and microbes in perianal fistulas, and we're aimed at discovery of novel therapeutic pathways. I will be providing a brief introduction to perianal fistulizing Crohn's disease. Following my introduction, we have a step-by-step wound care demonstration that will be presented by Rachel Densing. Rachel is a pediatric wound, ostomy, and continence nurse clinician at Mount Sinai's Kravis Children's Hospital in New York and has wound, ostomy, and continence certification. Next, we have Dr. Alexander Levy, an IBD specialized gastroenterologist and director of the IBD Fellowship at Yale University, who will be taking us through pain management and follow-up care for fistulizing disease. Following Dr. Levy, we have a presentation on nutrition tips that will be led by Danielle Geffen, a registered dietitian nutritionist. After helping her husband navigate the nutrition challenges of Crohn's disease, Danielle founded Eat Well Crohn's Colitis, a virtual practice dedicated to supporting people with IBD with personalized, evidence-based nutrition strategies. Then, Dr. Kaylin Clark, a licensed psychologist, board-certified in clinical health psychology, and an assistant professor of medicine at Oregon Health and Science University, will be discussing the importance of emotional support for patients with fistulizing Crohn's disease. Dr. Clark currently works with adult patients with chronic gastrointestinal conditions, providing evidence-based brain-gut psychotherapies. And finally, I will conclude the webinar to provide some final thoughts and share some important education and support resources from the Crohn's and Colitis Foundation to help you navigate your IBD journey. A few housekeeping items before we get started. Listed here are the financial disclosures of all our presenters. Please keep in mind that the information shared in this webinar is meant to be for educational purposes only and should not replace any advice or guidance from your own healthcare professional. Let's take a moment to say thank you to Bonnie and Andrew Stern for supporting the development of this perianal wound care initiative. Additional support is provided through the Crohn's and Colitis Foundation's annual giving program and donors. I'm so pleased to kick off this webinar with an introduction to perianal fistulizing Crohn's disease. Let's begin. What is perianal fistulizing Crohn's disease? It is a type of Crohn's disease where perianal fistulas form. These are small tunnels, just millimeters in diameter, that form between the rectum or anal canal and the perianal skin, which surrounds the anus, the opening where bowel movements come out. It affects about 20% or 1 in 5 of patients with Crohn's disease. Perianal fistulizing Crohn's disease can cause symptoms, including pain or discomfort in the area and drainage from the skin openings. It can have an enormous impact on patients' psychosocial well-being. Diagnosis of perianal fistulizing Crohn's disease generally requires evaluation by physical examination of the area in the doctor's office or in the operating room, an MRI of the pelvis, and colonoscopy. How do we treat perianal fistulizing Crohn's disease? The goal I tell all my patients is that we want to relieve your symptoms, the pain and or the drainage, such that you can fully function in your daily lives. When possible, the goal is also to heal the fistula. Our approach is through multidisciplinary care. This includes medications, The main IBD advanced therapies, such as biologics and small molecules, anti-TNFs should be first line unless contraindicated. Antibiotics can help improve drainage, and in some cases of very severe disease, hyperbaric oxygen therapy, which is a type of treatment that involves spending time in a chamber breathing in pure oxygen at higher air pressure levels. It has been used for several conditions, including decompression sickness, carbon monoxide poisoning, and burns and other wounds. For perianal fistulas, it is thought to aid in wound healing. In terms of surgery, colorectal surgeons perform exam under anesthesia, where they can perform incision and drainage of infections, place setons, which are thin rubber tubing that goes through fistula tracts to aid in drainage, and perform repair procedures to induce healing. Finally, about 6% of patients may have to undergo diversion surgeries, where the intestines are disconnected and an ostomy is created, which is an opening in the abdominal wall to allow stool to exit. These can be either temporary or permanent. The risk is higher in patients with complex disease. Of these patients, 20 to 25% will undergo proctectomy, or surgical removal of the rectum and fistulas. Last but not least is supportive care with pain management, nutrition, and emotional and mental health support. Next, I am delighted to introduce Rachel Densing, who will give us our wound care demonstration.
Hi, my name is Rachel Densing. I am a pediatric wound ostomy continence nurse, and today I will be showing you how to take care of your perianal fistula. We'll need a few supplies for your perianal wound care, starting with gloves, hand sanitizer, a wound cleanser such as Vosh or Hibiclens, dressings like gauze, a hydrocolloid, an absorbent pad, and tape, and lastly, skin protectant cream or a prescription cream such as Criticaid, Calmaceptine, Sensicare, Desitin, or A&D. So before we get started, we want to do hand hygiene. Wash your hands with soap and water or use a hand sanitizer. Then we're going to put on our gloves. So we're going to clean your wound, and we're going to do this by using some sort of wound cleanser, whether it be normal saline, Vosh, Hibiclens. Those are a few brand name examples of wound cleansers, and it can vary depending on what your provider requests. And there are two ways to clean your wound. You can either squirt the solution just so that you get nice and clean in that area, or you can squirt it onto some gauze and then do a dabbing motion in and around the wound. Once you have that done, then we would want to dry your skin, and again we're going to use dabbing motions to make sure our skin around the wound is nice and dry. Next, if your provider recommends using a cream or an ointment, we're going to put that cream or ointment on. Use however much your provider requests, and if you have any questions, feel free to ask your provider. So again, we're going to use the prescribed amount of ointment or cream. And just put it in that area. Lastly, your provider might want to put a dressing over your wound, whether it be an absorbent pad, an abdominal pad with paper tape, or a hydrocolloid dressing. In this case, we're going to use an abdominal pad, and we're going to sit it directly over the wound and use a paper tape to secure it. There are a couple of different ways for you to use the paper tape, whatever is more comfortable for you, whether it be 2 pieces on the side or taping all around, whichever is more comfortable. If you do have a seat and drain in place, we highly recommend using, again, the patting motions and avoid any wiping. A good idea is to have a bottle that has the nozzle so that you can easily squirt the solution into the area every time you use the bathroom. Or if you would like to get a shower head that's removable, you can easily clean that area in that way.
My name is Dr. Alexander Levy, and today I'm going to be talking about pain management and follow-up care. When it comes to pain management, it's important that patients take their prescribed medications as needed and as directed. Over-the-counter medications such as acetaminophen or Tylenol are thought to be safe in IBD. However, we generally recommend that patients avoid NSAIDs such as ibuprofen or naproxen, which are thought to worsen their underlying IBD. Over-the-counter or prescribed topical pain relievers can also be helpful, and the most common of which we use is lidocaine. So the next potential option are sitz baths. So what is a sitz bath? This is a warm water bath that you sit in to relieve discomfort from your perianal region. You can add Epsom salt, but this is not necessary. Another thing to keep in mind is that sitz baths in a bathtub are generally thought to be better than those on a toilet because you're able to get more of your perianal area into the water. Now, sitz baths have multiple potential benefits. Soaking the perianal region reduces swelling of the anal sphincter and helps increase blood flow through the anal tissues. And this helps to promote healing, improves perianal hygiene, and can reduce pain, itching, and skin irritation. Now, all of our patients have very busy schedules, but it's important to remember that even small sessions as short as 5 to 10 minutes can be helpful. And this can be done before or after work, after bowel movements, or really any time that you have anal discomfort. The next topic to think about is wound protection and comfort. Here, we generally recommend that patients wear loose-fitting underwear to minimize friction and further irritation of the perianal wounds. We also recommend that patients avoid tight clothing that may cause discomfort or impede wound healing. Another thing to consider are seat cushions, as well as absorbent pads to absorb wound drainage. Lastly is follow-up and monitoring, which is really critical to improving patient outcomes. It's important that patients keep all their follow-up appointments with their healthcare providers so that they can monitor their wound progress and ensure proper healing. It's also just as important that they report any concerning changes, such as increased redness, swelling, pain, pus drainage, or fevers immediately, as these are potential signs that the perianal disease is worsening. So on that note, I'm going to be passing over to my colleague Danielle Gaffin, who will be discussing the importance of nutrition for IBD perianal wound care. Thank you.
Hello, everyone. I'm Danielle, an IBD-focused registered dietitian nutritionist. For oral diet recommendations, a high-calorie, high-protein, and high-sodium diet is typically recommended to address nutrient losses, to maintain adequate nutrition, support tissue repair and healing, and for diarrhea or wound damage. Oral rehydration solutions can help restore electrolyte balance and rehydrate a patient more quickly than water alone. Soluble fiber gel stool together that can make stool easier and more comfortable to pass. Foods like oats, rice, avocado, peeled potatoes, peeled apples, ground flaxseed, chia seeds, and pureed beans or lentils are good sources of soluble fiber. However, it's important for patients to try these foods in small portions at first to determine individual tolerance. Changing the texture of produce, like blending into smoothies or pureeing into soups, mechanically breaks down fiber, making these foods easier to process and more tolerable as it passes through an inflamed or irritated area of the digestive tract. Peeling produce reduces the quantity of insoluble fiber, which can make fruits and vegetables easier to tolerate. And cooking vegetables without fibrous stalks until they're fork tender can help improve tolerance as well. It's common for individuals with Crohn's disease to report that specific foods may trigger symptoms. Here are some common trigger foods that may need to be limited or avoided depending on the individual: spicy and acidic foods, high lactose dairy, caffeine, which increases anal sphincter contractions, and insoluble fiber, which, for example, can be found in the peels and skins of fruits and vegetables, nuts, and seeds. This type of fiber can increase stool bulk and speed up transit time, which may exacerbate symptoms. Some patients and healthcare teams may want to consider therapeutic diets for ongoing inflammation. For example, elimination diets, like the specific carbohydrate diet or SCD diet, and the Crohn's disease exclusion diet or CDED diet. While these diets show variable efficacy in fistulizing Crohn's disease, they may provide relief for some patients by reducing symptoms and inflammation. Then there's exclusive enteral nutrition, or EEN, which is a liquid only diet that provides 100% of a patient's nutritional needs. It's often recommended for 8 to 12 weeks and can be given orally or through a feeding tube. Research shows that EEN is effective at inducing remission, especially in pediatric patients, and can promote mucosal healing. There's partial enteral nutrition, or PEN, which involves a combination of liquid formulas and solid foods, with the liquid nutrition providing 25 to 75% of a patient's estimated daily needs. This allows for some flexibility, but it's also important that the solid foods consumed are modified to meet the patient's specific dietary needs, particularly regarding food consistency and fiber. And finally, there's parenteral nutrition, or PN, which is an intravenous feeding method used for patients with severe malnutrition or high output fistulas that make it impossible to meet nutritional needs through oral intake alone. PN provides complete bowel rest and delivers 100% of a patient's nutritional requirements and can be used as a bridge to oral diet therapy while correcting malnutrition and fluid imbalances. Post procedure, there are several nutritional recommendations that healthcare teams can provide patients to set them up for success. First, we want to normalize bowel habits by balancing fiber intake and avoiding food triggers that could exacerbate diarrhea or constipation. Protein needs significantly increase, typically double the normal intake, as this macronutrient is essential for tissue repair and growth, supporting wound healing. And of course, we want to ensure adequate caloric intake with nutrient-dense foods to prevent malnutrition and support recovery. And zinc supplementation may be appropriate to consider as well, as zinc supports wound healing and immune function and is often deficient in patients with fistulas. And finally, working together with the entire healthcare team, including dietitians, to help patients identify trigger foods, manage symptoms, and ensure nutritional needs are met can significantly impact their healing, recovery, and long-term outcomes, improving overall quality of life. For a referral to an IBD-focused dietitian, a great starting place is to check with your gastroenterologist or reach out to the Crohn's and Colitis Foundation. And next, we have Dr. Kaylin Clark, who will be sharing with us some thoughts on emotional support for perianal disease.
Hello, I'm Dr. Kaylin Clark, and I'm a clinical health psychologist at Oregon Health and Science University in Portland, Oregon. And I'm here to talk to you today about emotional support for patients with perianal fistulas. So, to start with some strategies to discuss your concerns and preparing for your visit with your GI surgeon or GI medical provider. Considering writing down your symptoms, questions, and concerns ahead of your visit so that you feel fully prepared before your visit. And considering sending questions in ahead of time through a patient portal if that's accessible to you. You might also find it comforting to bring a trusted relative or friend for support. During the visit, make sure to ask as many questions as you feel like is necessary so that you feel comfortable with the treatment plan. It's also important to discuss the location and severity of the pain related to the fistula and how it impacts your day to day life. Also, asking about recovery time and post op limitations, which can reduce stress so that you understand what to best expect in your recovery time after the procedure. Also, asking for any additional information that your provider might be able to provide for you, again, to best prepare you for any sort of expectations during and after the procedure. And so, thinking about what are expected outcomes for your treatment for the fistula. Many patients believe that starting a biologic medication will close their fistula. And while that might be the case for some people, that's not always the case. So, understanding whether that's the expectation for you. Also, understanding whether if it's recommended for you to have a closing of the fistula or leaving it open with a ceton, and what are pros and cons for both options. Also, understanding from your provider what is expected in terms of time frame that the ceton might need to be in place, either for a short duration or thinking about it for the long run. And also asking how having a ceton in place will impact the effectiveness of the medication that you're already taking. Navigating relationships can be really tricky when you have a perianal wound. So, in social situations, finding ways to communicate your needs in a comfortable way. And at the same time, knowing your boundaries in conversations with others so that you can communicate as much information, but not feeling like you have to overshare. Also, encouraging questions from other people. In your community so that they better understand how to support you and what you're going through. Even though it's uncomfortable, it's really okay to address fluid leakage, incontinence, and passing gas. These are all common experiences that people with IBD and especially perianal wounds do experience. And finding the humor can be really important in navigating these really uncomfortable situations. And over time can make it feel easier to talk about these challenging topics with other people. Intimacy is another situation that can be tricky to navigate with a perianal wound. Again, communicating honestly and openly with your partner about your needs is really important. You might need to get creative with different positions in order to minimize discomfort. Again, finding a sense of humor with all of this and listening to your body is really important. Navigating work and school can be challenging when managing recovering from a perianal wound. And so at work, understanding and communicating any recovery time with your employer can be helpful, especially with as much advance notice as possible. It can be helpful to request accommodations, especially time off for medical appointments and rest if needed. Also, it's important to understand how your medications could affect your job duties or responsibilities, especially when medications could have a sedating impact. Also, taking into consideration any prolonged sitting that could impact your wound healing. For those of you who are in school or thinking about pursuing school, considering connecting with your school's Disability Support Services office to get an understanding of what accommodations could be available for you. Also, considering the recovery time that you have after your surgery and how that might impact your course load or any exams. Also, discussing with your doctor any appropriate accommodations that they might recommend that you might not be aware of, and that could be related to housing or transportation. We all know that physical activity can be really helpful for stress management and to also boost mood. However, after getting a procedure done for a perianal wound, it's really important to ease back gradually and slowly into physical activity and waiting until you've gotten medical clearance to start physical activity. For many people, vigorous activity can be really uncomfortable with a wound. And so that's another reason why it's important to focus on starting slow and easing gradually back into activity. It's critical to avoid swimming until your wound is completely healed. And again, listening to your body. It's important to get various types of help and support when you're navigating getting treatment for a perianal wound. So it's not only important to have the support and guidance from your GI medical provider and team, your GI surgeon, but also considering support from a mental health provider, especially one who has specialty training in GI psychology. And so it's important to ask your GI medical team if they have recommendations, especially if you have access to a GI psychologist that is connected with your GI clinic, or if there are recommendations for a GI psychologist or other similarly trained mental health provider in your community. The Rome Foundation, through this website, romegipsych.org, is a great resource that has a directory to search for local providers who are also similarly trained. It can also feel very helpful and supportive to connect with other people online or in person through support groups who have also gone through getting treatment for a perianal wound. And with that, I'm going to turn it back to Dr. Wong, who will share with us some final thoughts and recommendations in terms of resources for you.
Thank you, Dr. Kaylin Clark. If you or your loved ones are living with perianal fistulizing Crohn's disease, we hope that you have found this video helpful for your overall care and maintenance. In addition to Dr. Clark, thank you again to our presenters, Rachel Densing, Dr. Alexander Levy, and Danielle Gaffin. Thanks also to Dr. Shannon Chang, Dr. Mukta Crane, Dr. Vitali Poilin, and Dr. Tausif Ali from the surgery work group of the Foundation's Patient Education Committee for their expertise in reviewing the content. Thank you also to Joshua Lacoste and Dr. Rachita Yona for their input and contributions to this project. As our program comes to an end, on behalf of the Crohn's and Colitis Foundation, we encourage you to keep learning about IBD and to visit our helpful educational resources. Our website offers a lot of information for you to learn more about fistulizing disease, fistula care, nutrition, and emotional support. The QR codes listed here will take you directly to those specific topic areas. The IBD Help Center is there to provide information and resources to patients, caregivers, and healthcare providers about inflammatory bowel disease. They're available by phone or email, as well as by live chat, currently available Mondays, Tuesdays, and Thursdays. If you're looking to connect with other patients and caregivers, the Foundation offers virtual and in-person support groups. The QR code at the bottom right of your screen will help you locate a support group near you. Thank you again to our expert presenters and to you, our IBD community, for joining us today.